following presentation is a review of a process evaluation performed by Crystal Crane, Megan Jennings, Zalia Dunbar, Kimberly Chambers, and Tiara Durant Sutherland on instituting the federal smoke-free policy at East Lake Healthy Living Community. Studies have shown that public housing typically has poor ventilation and structural defects, houses high concentrations of smokers, along with non-smoking pregnant women and children. Both smoking and exposure to secondhand smoke have been linked to adverse health conditions, including asthma, hypertension, chronic obstructive pulmonary disease, and severe psychological stress. Tobacco use in public housing is an important area for social workers and for researchers because cigarette smoking is one of the leading causes of preventable morbidity and mortality in the United States. Each year, there are nearly 500,000 deaths and over $300 billion in healthcare expenditures due to the direct use of tobacco products. Substantial intervention research is needed to determine the effectiveness of smoke-free public housing policies, which methods are the best ways of implementing new practices, and how to reduce the overall cost incurred. The population at East Lake Healthy Living Community includes 542 apartment units. Approximately 60% of the entire population is estimated to be affected by the federal smoke-free policy. This population also includes the residents, visitors, and staff. According to the U.S. Census Tract 208.02, which is DeKalb County, Georgia, zip code 30317, there is a total of 4,365 people included in the population. 56% is female and 44.1% is male. This also includes 966 children under the age of 18, and adults include 3,399, or 77.9%, between the ages of 18 and 85 years old. 36.5% are white, 58.7% are black or African American, 3% are considered Asian, 6% identify as Hispanic, and there is 2.6 persons average per household size. The population data continues here on this slide, and the tables you see here are extracted from the software program called Social Explorer. Here you see Census Tract 208.02, and it includes the total population, the sex, the age, race, and whether or not an individual identifies as Hispanic or Latino or Asian. This data was extracted from the U.S. Census Data American Climate Survey from the year 2016, and these are done in 5-year estimates. We will conduct a process evaluation to evaluate the East Lake Healthy Living Connections plans and procedures to implement the federal smoke-free policy for all public housing. The overarching goals of this evaluation will be to assess whether the policy can be implemented effectively and within the allotted time frame of 18 months from the effective date. There has been marginal research done on smoking cessation mandates in public housing. The studies have varied in terms of what was being measured, such as how the property management companies have handled the implementations of smoke-free policies, how it impacts the residents, and smoking cessation resources. The research indicates that more the involved residents are in the process, the more successful the smoke-free policies can be. Yerger, Battle, and Moore examined how smoke-free policies were going to be implemented among multi-unit housing communities in Richmond, California. Pizzacani, Mayer, Rode, Drake, and Stark studied the implementation of a smoke-free policy in multi-unit housing and the impact it had on residents in Portland, Oregon. Andrews et al. Looked at the unique barriers that African American women face related to smoking cessation. The studies highlighted indicate that smoking cessation policies can be successful if the proper requirements are met. Resident involvement, access to resources, and education can help assist individuals who no longer smoke due to the smoking ban policies from property management and government entities. By examining the current smoke-free policy implementations, data and feedback can be collected to determine how reliable the current administration is of this policy. This extends the social work body of knowledge because it is important to note how the residents are being treated during the smoke-free implementation, and if evictions do take place, what steps could have been taken to avoid that scenario. The purpose of public housing or subsidized housing is not to have people living on the streets with nowhere to go. Evicting them for smoking undoes all the hard work that got them into the housing to begin with. We will conduct a process evaluation to examine the implementation of the federal smoke-free policy. By conducting a process evaluation, we will gather data to assist the partners and stakeholders in identifying and addressing potential shortcomings, gaps, and challenges of the program's implementation. The utilization of the process evaluation can assist in identifying the community members' risk of negative impacts. For this evaluation, we will examine the following questions. Will the community receive adequate time to comply with the federal smoke-free policy? Are the community residents knowledgeable of the consequences associated with the non-compliance of the smoke-free policy? What provisions, to include resources, programs, and activities, will be utilized to educate the community residents for policy compliance? And were the provisions effective in attaining policy compliance and readiness to change? The community of Eastlake Village Apartments is comprised of a group of residents ranging from infants to adults aged 55 years and older. The community consists of independent living with single-family dwellings. The evaluators will utilize convenient sampling by attending the resident community meetings, which occur monthly from January 2018 through April 2018. At each meeting, we will ask the residents that are in attendance to fill out a survey regarding the new federal policy and if they would be willing to participate in a brief individual interview. Convenient sampling will work best for this evaluation because the residents are easily accessible at each monthly meeting. The procedure for collecting data for this process evaluation will vary for the qualitative and quantitative surveys. The evaluation instrument used will be the attitudes and beliefs towards government interventions to influence or regulate legal substance and tobacco use. Quantitative surveys are less time and labor intensive than qualitative interviews and will allow the researcher to collect data more quickly and efficiently. For the qualitative response, survey instruments will be collected and coded by the researchers to be stored for further review. Distribution of the surveys will be done at the community meetings and collected by the researcher assigned to attend the community meetings on a specific date at the clubhouse of Eastlake Villages. Conducting the survey should only take about 10 to 15 minutes for each individual and would occur once a month. Along with each survey, each participant will be provided with an informed consent as well as a demographics questionnaire. Each informed consent form will provide explicit detail with regards to participation and confidentiality, and each participant will be required to agree with and assign the informed consent before each survey is conducted. Each participant surveyed was also provided with a demographics questionnaire, which identified their gender, their age, their race, and whether they were married or unmarried. Our results concluded that there were 9 males that participated, 16 females, 9 people, male or female, were between the ages of 18 and 34, and 16 people were over the ages of 35. 4 individuals identified as white or Caucasian, and 20 participants identified as Black or African American. There was 1 Hispanic and 0 Asians. 9 people recorded that they were married, and 16 recorded being unmarried or in a long-term committed relationship. The instrument used for this process evaluation will be the attitudes and beliefs towards government interventions to influence or regulate legal substance and tobacco use. This instrument is used primarily to gauge the current attitudes of the Eastlake Village residents affected by the federal no-smoking policy. The survey has a total of 26 questions that are answered in a 4-category Likert-type response. The answers range from 0 to 3 and include the responses definitely agree, probably disagree, and definitely disagree. Each item is scored ranging from 0 to 3 based on the response, and the higher overall score indicates more pro-tobacco attitudes. A thorough analysis will discover the mean and mode of pro-tobacco attitudes, and the mean will determine if a higher number of pro-tobacco attitudes exist, and the mode will determine how often the scores occur. Based on the results of our surveys, the mean was calculated at 42.12, and the mode was calculated at 47. On the graph you see here, it includes the scores from the 25 participants that were surveyed. During the interview process, 3 themes consistently occurred. These themes are community resources, fear, and enforcement. The first theme, community resources, occurred several times throughout the interview process. One of the participants, a 46-year-old non-smoking black woman, was asked, "What do you think would be the best approach for the Eastlake Healthy Living Connections program to implement the smoke-free policy?" She stated, "Because smoking is a habit or an addiction and is a part of a smoker's lifestyle, it will be very challenging for a smoker to just suddenly quit. The residents' need for health-related resources will increase. I feel that it is a great idea for the property management team to offer or link the residents to more community resources and programs that can help smokers who want to stop smoking, such as smoking cessation classes, and offer healthy living activities such as free cooking and workout classes." Another theme that consistently occurred is fear, or the consequences associated with the regulation of the new no-smoking policy. This theme refers to the concerns related to the potential loss of affordable housing, the loss of community resources, and the access to the high-quality education offered by Drew Charter School. One of the residents, Miss F., stated, "The cost of housing has increased drastically over the years. Where do they expect people, myself included, and their families to go if evicted for smoking cigarettes?" Another resident expressed her concern by stating, "There is an elder resident that has smoked for the entire 16 years that I have known her. She is dependent on nicotine and will either become drastically ill if forced to quit smoking or lose her housing. To be honest, I don't know how I really feel about this policy, but one word comes to mind to describe what is going on, and that word is gentrification." The final theme that occurred is enforcement, or the lack thereof. Enforcing the new federal no-smoking policy will create much resistance and present challenges during the phases leading up to implementation. Mr. C stated, "A couple of years ago, the Homeowners Association sent a letter stating smoking inside the units was prohibited, as well as on the outside patios. I started smoking again a month ago, and no one has said anything. I don't think there is a plan if someone is caught smoking." Collecting various types of data helps evaluators conceptualize the issue from diverse angles and strengthens the understanding of target populations before implementing smoking cessation programs. Qualitative and quantitative data, such as interviews, surveys, and observations, will be collected from residents to help measure, track progress, and develop interventions. If data is collected routinely throughout the process, program evaluators can adapt the program inputs to improve successful transitions among the community. This overlap will strengthen the program's success where other previous efforts have failed to satisfy the standard. A distinct limitation of this evaluation is the amount of qualitative data collected. Surveys are only collected from those patrons who are present and willing to participate at the residential community meetings. The sampling procedures are a limitation as well because they are non-probability and may not be truly representative of the entire community. The current literature pertaining to the process evaluation and the development of the no-smoking policies to be carried out among residents in mixed housing communities is not very broad. The existing field research will be dependent upon documenting the planning efforts of Columbia Residential and Eastlake Healthy Connections as they continue to make preparations to impose the federal mandate. This research is important to social work because smoking is the leading cause of mortality in the United States. When practices and procedures are evaluated in this intervention, strategies can be adjusted and adapted for future policy implementation. And this concludes our presentation. Thank you for participating and hope you enjoyed it.